Thank you so much for joining the National Civic League's May Promising Practices webinar, Community Engagement Strategies for Reducing Vaccine Hesitancy. My name is Rebecca Trout, and I am the director of the All-America City Award Program and DC office here at the National Civic League. For those of you who are less familiar with the League, we are a 125-year-old nonprofit, and we use community assistance, research and publications, as well as awards and events to really lift up astounding examples of community problem solving and civic engagement to create more equitable and thriving communities. The All-America City Award is our flagship program, began in 1949 to really recognize and celebrate those communities who are using civic engagement to solve local problems. And while we use that annual award competition and event to celebrate those communities, we really use this webinar series to share those best practices, as well as other tools, resources, and other community examples of civic engagement practices that can solve those local problems. Before we dive too much into today's topic of reducing vaccine hesitancy, I just want to give a quick plug for this year's All-America City Award program. As I mentioned, we are in the planning stages. So if you look at the important dates on the slide in front of you now, we are creeping towards that June 9th through 11th event date. We're so excited to be in person in Denver for the first time in 3 years after 3 virtual events. Our communities this year are really going to be talking about how they're engaging youth to solve issues of health and well-being. And so we will have those finalist presentations, as well as workshops, some inspiring keynote speeches, and some great interactive peer learning opportunities. I encourage you to come to that if you've never been. I'll send a plug and a registration link in my follow-up email to you. And then speaking of those finalist communities, so you'll see all 20 of them mapped out on the screen in front of you. They range from they come from 12 different states and range in population size from 4,500 all the way up to 8 million. They are covering topics this year from everything from career and college readiness to voter engagement to mental health and to public safety. So you'll be able to hear some of their inspiring work and projects if you come to this year's event. Great, and without further ado, I want to introduce our speakers. Today we are talking about the continued importance of promoting vaccines and doing community engagement campaigns to raise awareness about the need for those COVID vaccines. We're going to be joined by Erin Hamlin, who will be talking to us about the HHS COVID-19 public education campaign, We Can Do This. And then we will have a great community example coming out of Northeast Wisconsin. Dr. Pam Purr and Lisa Cruz both founded the Multicultural Coalition to address issues of vaccine access and equity there in Northeast Wisconsin. And they'll be talking a little bit about their efforts and some suggestions and resources for other communities. Before I hand it off to their capable hands, I just want to go over a couple of housekeeping rules. You'll notice that you are all muted, so please remain so until the very end of the webinar when we'll have an opportunity for Q&A. You can use the chat throughout the webinar to insert any questions, and then you can also use the raise hand feature and we'll unmute you if you have questions at the end. You'll also notice that we are recording this webinar. The recording will be sent to you along with the slides either after the conclusion of today's webinar or early tomorrow. So in case you want to be furiously taking notes, you can wait and get the recording and the slides later. And without further ado, I want to hand it off to our first speaker, Erin. Erin, can you get us started?
Great, thank you so much, Rebecca. Let me go ahead and share my screen. Let's see here. Okay, can you see that okay?
Looks great.
All right, great. Thank you so much, Rebecca, and thanks to everyone at the National Civic League for having me here today. Again, my name is Erin Hamlin. I am the Partnerships Director for We Can Do This, which is the public education campaign at the Department of Health and Human Services, focused on really increasing COVID vaccine uptake and vaccine confidence. So again, to go a little bit into the campaign, if you're not familiar with us, the campaign launched in April of 2021. It has really evolved over time based on where we were and are in the pandemic, and where we've kind of focused our efforts. In the beginning, the focus was a lot on prevention, things like masking, physical distancing, testing. And then once vaccines became available and then more widely available to the general public, we've really focused in on making sure we can reach people with vaccine information and helping them to get vaccinated. We operate essentially as a large communications campaign. So we do a lot of paid media through commercials, digital radio ads, things like that, as well as earned media through local doctors on radio interviews and media outlets, and then of course partnerships. And I'll dive a little bit into the partnerships program specifically. We've had a really ambitious goal. The goal of the campaign is to reach 90% of Americans at least one per quarter. So that's reaching every American on average about 10 times. So far, we've garnered about 82 billion impressions. So really doing what we can to reach everyone where they are in their communities with this really important life-saving information. In addition to focusing in on kind of the vaccine hesitant population, and right now really focusing in on older adults who are at higher risk for severe outcomes due to COVID, we also have a really strong equity focus as well. So we are focusing in now on a few different kind of priority populations, that being Black adults or Black Americans, specifically adults over 50, the Latino community, Asian American and Pacific Islanders, American Indian and Alaska Natives, and rural audiences. I'll talk a little bit more about the resources we have on our website in a bit, but nearly everything that we produce is available in both English and Spanish. And then we have kind of a set of priority materials that are produced in a variety of other languages as well. That includes Chinese, simplified and traditional, Vietnamese, Korean, Tagalog, Japanese, and a few additional resources in Haitian Creole, Russian, and Arabic. So again, this is a little bit more of the kind of inside workings of the campaign structure. As I mentioned, the vast majority of the campaign work is paid media. About 75% of our campaign is focused on reaching folks through a large paid media campaign. But our campaign is also extremely research driven. So we have a pretty intensive research team that is constantly evaluating the impact of the campaign, doing message testing, monitoring vaccine uptake to make sure that we are focusing in our limited resources in the right geographic areas where we can have the biggest impact. And then again, making sure that we are evolving throughout time to make sure that we're reaching the right audience with the right message through the right trusted messenger. So again, very research driven. Again, I talked a little bit about our earned media. We do quite a bit of earned media through what we call our local trusted doctors network. So that is working with local doctors to get them on their local radio outlets in their area. So you're kind of hearing from people within your own community. And again, kind of doubling down on that trusted messenger and reaching folks with messengers that are going to resonate. And then, of course, we have partnerships, which is a lot of what I do with the campaign, and I think is a pretty unique and innovative part of a campaign like this. So to dive a little bit into our partnerships program, we've partnered with hundreds of organizations throughout the course of the campaign, both national, regional, state, and what we call hyper-local partners. So kind of very small, very focused in partner organizations. Working mostly with community-based organizations as well as some other partners. You can see here, these are a few of our national partners. Like National Civic League, we are currently partnering with the American Heart Association, particularly to reach that older adult kind of senior population that we're focused in on now. But we've also partnered with the Association of Children's Museums, the National PTA, Boys and Girls Clubs, especially during the points of the campaign where we were really focused in on reaching parents. When children 5 to 11 first became eligible for vaccines, and then later that kind of younger cohort of children 6 months to 4 years that became eligible a few months ago, it was really important that we kind of focused in on organizations that parents trust, working to reach people or reach parents kind of where they are, whether that is at their school, at their after school care, their extracurricular activities, to make it as easy as possible to kind of reach people in their communities with information that will help them to get their kids vaccinated, to have the information to feel informed, to go ahead and make that decision to get vaccinated. In addition to those kind of national partners and those kind of big name trusted organizations, like I mentioned, we also work with what we call hyperlocal organizations. I think this is, again, a really unique way where we can get into communities that we might not necessarily reach through just a purely paid media campaign. For example, we worked with an organization in Chicago that focused in on reaching the Vietnamese population of a Chicago neighborhood where there was highly populated with a Vietnamese community. Not a whole lot of English speaking, primarily Vietnamese speaking. So we worked with this group to, use their community leaders as trusted messengers to produce flyers and posters that were written in Vietnamese, have those hung in markets and convenience stores run by the Vietnamese community. So we could really, again, reach people in language with culturally appropriate materials that they just might not be reached through kind of the traditional communications or commercial in English. So really doing what we can to go above and beyond, reach people where they are through the right messengers through our partnership program. I also want to touch a little bit on this third bullet here, what we have called the COVID Community Corps. So this is a national volunteer corps that we also launched about 2 years ago now, made up of about 15,000 members. Mostly organizations like ours or yours who are doing a lot of this vaccine outreach, but then also just individuals who wanted to have the latest information about talking to their friends and families and neighbors about getting vaccinated and when they're eligible and what they might be eligible for, whether that's that next updated vaccine. This is really the best place to get kind of the latest information and newest materials that our campaign is producing. So if you're not already signed up for the COVID Community Corps, I definitely would recommend that you do so. And I'll have that on the next slide coming up of how to do that. Okay, so I talked a little bit about the resources that we have. You can find everything on our partner website here. You can find this at wecandothis.hhs.gov. Again, mostly everything is available in both English and Spanish, and then all of our other language assets will also be available on this site. We have a ton of toolkits, informational content, social media content, posters, a variety of different things that are really meant for partners to try to make it as easy as possible to share out this information. All of that is meant to be customizable, so you can tailor it to your audience. You could take a sample newsletter or sample e-blast, put in your own contact information or your own specific messaging, copy, paste that, and send that out. So again, really meant to be as easy as possible to just blast this information out through your own communication networks and channels. And then I pulled out a couple different examples here of some of the resources that might be especially relevant for this audience. Again, I mentioned we have a ton of toolkits. This is a snapshot of our general audience toolkit, but we have toolkits for healthcare workers, for older adults, for school communities, anybody that you might be speaking with or talking to. We have resources tailored to that community. Again, we have a lot of posters and flyers, as you can see here. This is meant to be something that you can easily print out and hang up in a waiting room or a lobby. You'll see, it might be a little hard to see here, but next to the We Can Do This logo, there's an intentionally left blank space so that you can drop in your own logo or, again, any kind of contact information, something that you want to add in to make it a little bit more personalized or customized to you and your organization. And again, of course, a ton of social media content. Here's a sample graphic here, sample text messages. Again, you can either copy and paste and send just as it is, or tailor it to your own messaging. In addition to those, here are some resources specific to reaching older adults. Again, that is our focus of the campaign right now, as adults 50 and older are just at higher risk for illness or for severe illness or hospitalization. So that's really where we're focusing in our efforts now. This first graphic is actually an animated graphic that explains how older adults are at higher risk. The middle image is a campaign ad that says that 9 out of 10 COVID deaths have occurred in adults 50 and over, which is, again, why we're focusing in on this population. And then finally, a snapshot of one of our outreach flyers that explains eligibility. We're actually in the process right now of updating all the resources on our website to include the new eligibility guidelines that came out just about a week ago from the FDA that states that folks who are 65 and older or immunocompromised can now get a second updated vaccine. So we'll have resources available likely tomorrow or later this week up on our website that explain some of that new, somewhat complicated messaging about eligibility. In here, I wanted to touch a little bit on, how we talk about updated vaccines and messaging about vaccines when we know there's a lot of misconceptions, a lot of misinformation, a lot of hesitancy, and really just a lot of confusion out there. So here we have a few of our kind of tips and guidelines about how to go about having these conversations. You can see here a couple snapshots or screenshots again of some of those materials, how to talk to your friends and family about COVID-19 vaccines, FAQs, facts about vaccines, that all list out all of this factual information in a way that is plain language, ideally easy to kind of take and mold into the conversations that you're having. What we have found is really, especially with that kind of vaccine hesitant population, that kind of movable middle, if you will, people just have a lot of questions. They just need to get the answers they need to feel confident that they are fully informed to make the decision to get the updated vaccine or get the pediatric vaccine for their child. So really just listening to those questions with empathy, asking open-ended questions to kind of get down to what is the main concern here, and asking to share information. So say, can I send you this video? We have a ton of expert videos on our website as well from our Surgeon General, and other doctors and other experts that kind of break down some of these common misconceptions in a way that hopefully is really easy to understand and easy to share. And then here's some more social media assets that kind of speak to some of the top questions or concerns that at least I hear a lot in our work here. I think, again, there's a lot of confusion about eligibility. Sometimes folks think, oh, I am up to date because I had a vaccine last fall. Last fall maybe was August when they got one of the previous boosters, but not the updated vaccine, which is the bivalent vaccine that fights both Omicron and the original vaccine or original strain. So just kind of breaking down that eligibility, making sure folks know when they're eligible, who's eligible, and encouraging folks to go out and get their updated vaccine. Similarly, we get a lot of questions about the safety and efficacy of the vaccine. So we have a lot of COVID fact infographics like this one, and again, a lot of videos that kind of answer a lot of those questions. And then long COVID. We get a lot of questions now about long COVID. And one of the things that we've seen is that long COVID can actually be a really great motivator to get your updated vaccine if you've already had COVID. We've heard from folks who got their primary series, but then later got COVID and it was a relatively mild case. It might not be you might not seem like a big priority to go ahead and get your next booster, your updated vaccine. But we found that preventing long COVID is actually a really great motivator for that exact reason. So even if you're having a mild case of COVID that, maybe it just lasts a couple of days, feels like a common cold, you don't want to get long COVID and potentially, have symptoms that last months or longer than that. So we've seen that that's a really great motivator to go ahead and get that updated vaccine. And then lastly, I wanted to touch on some of the community events. I know some folks on this call might be doing some of their own, vaccine pop-up clinics, mobile clinics, or educational sessions. We are working with, again, a variety of partners all across the country to host events like that as well. You can also find our kind of list of upcoming events on our website. You just click on community events, you'll see everything that we have coming up. We would love to hear what you're doing. So if you are hosting events, we would love to amplify them through our community events page through the COVID Community Core. Please reach out, let us know. We'd love to partner. We would love to amplify anything that you might be doing. And again, I know hosting events might be a big endeavor, but there's a lot of other things you can do as well to make sure that we're getting the information out. Again, we are producing these resources all the time, we're making updates constantly. So we hope that you are able to use them, share those flyers, posters, digital communications, anything, hopefully it is already available. If it is not available, please feel free to reach out to us and we'll love to see if we can try to make something happen. We'd love to tailor a toolkit and make sure that you're getting the resources that you need. And then again, please do sign up for the COVID Community Corps so you can make sure you're getting those new resources and getting those latest updates as soon as they are happening. And last, here's my email. So please don't hesitate to reach out if you have any questions about those resources or about the events that we're hosting. I would love to connect. All right. And with that, I think I will turn it over to Lisa.
Give me 1 second here, please. Well, thank you so much. We're happy and thrilled to be here today to share with everyone what we have learned. I am with the Multicultural Coalition, and Dr. Pam is with me. She is also a board member of our organization. So I'm going to try to condense what we have been doing for the past 3 years into about 7 to 8 minutes, and then I will turn it over to Dr. Pam. So as a community, when COVID hit, we felt that we could do better as a community. And there was a need and a gap in what was taking place in Northeast Wisconsin in relation to our most vulnerable, which in our area many times is our communities of color, and the services that we have available, the resources that we have available in our area. So if you're not familiar with Northeast Wisconsin, this is a map of Wisconsin. We always like to say we're 3 hours north of Chicago, and we are 30 minutes south of Green Bay. And usually by the time I say either of those things, I'll have some recognition for where we're at. And our region are these 3 counties. So that was very intentional. We have these 3 counties that intersect and that serve many of the communities of color that we are focused on. And then I have this in here, personality profile of Northeast Wisconsin. Primarily a more conservative leaning, I guess I would say, community, a little bit more traditional in how we do things and the hierarchy and how the structure is set up within our community. I think what you would find here is probably fairly common in other smaller communities. Between the 3 counties, I think, or we have what we call the Fox Cities, a string of smaller towns that run through those 3 counties. It's a couple 100,000, 250,000 around there. So that is our outreach area. So our story begins about 3 years ago, as I mentioned. We knew that we needed to do better as a community. Personally, I have been in this community a couple of decades, and I have been a part of nonprofits and have had that experience. And just knowing when the pandemic hit, it was such a crisis. And then learning and listening with our communities of color about what was taking place or was not taking place, we decided to come up with the coalition, together collaboratively with all of our communities sitting around the virtual table. But one thing I want to make sure that comes across, when we decided to galvanize and build the coalition, we knew we were building an organization, and our delivery and our efforts were going to be long-term. So what I mean by that is we're not going to build something and just focus on COVID. And then what came to be is once we started doing our outreach clinics, going to where our communities are, that's the basement of barbershops, that's churches, that's schools, parking lots, like you name it, we have done outreach everywhere, is that we started to learn then about more and more needs of the community. And Dr. Pam will also talk about some of our strategies at the core was building trust. So we started doing the work 3 years ago when COVID appeared. And I will also tell you that we started without funding because we so passionately knew and were experiencing firsthand the devastation of COVID, especially to our most vulnerable populations. Like, it was the right thing to do for us as community members coming around the table and then figuring out how to act together. So Dr. Pam always tells me, like, as communities of color, we are tired of talking and it's time to act. So I will also tell you that when we decided to do our first outreach vaccination clinic, it was 10 days before. And we had never done this sort of thing, but we were able to pull together the resources, the vaccine, everything we needed to do to be safe and also to promote that event in 10 days. And at that first event, we saw 118 people come through the doors at a local marketplace that primarily served the Hmong community. And I will always remember the last person that came to that clinic with 5 minutes to spare. Dr. Pam and I still talk about this to this day, and it made me realize firsthand the impact we could have, is when family members carried in their elder to be vaccinated, and we brought the chair out to him. So that was the first clinic, and now going fast forward to 2 years of actually doing the clinics, we're at about 70 clinics and then about 150 total community outreach events. So we just keep rolling through, but it's not without its barriers, and we'll also talk about that. So we are happy to start as a community-based organization, which in our state at the time was not being recognized for funding. So we were always a little bit ahead. We eventually got to funding, and that was fantastic to finally have some funds to continue the work. And then last May, we became a 501c3. So our mission, this was formulated early on as well. It's a movement, and we love to say movement because that equates to action. So we're constantly acknowledging racial biases, and then how can we proactively reach our communities of color? And Erin, a lot of what you were talking about from the communications end, that's actually where we started as a coalition, focused on the information that needed to be a priority getting to those we served, not an afterthought. So right from the beginning, we were addressing misinformation, getting the information direct from public health, and we were being and serving as that connector between our communities that we were serving and public health with our trusted messengers as well, and our grassroots organizations. So, and while we're talking and focused on COVID today, which continues to be a priority for our community, that we also are moving into this space such as education equity, health equity, and housing. So those are also priorities as have been identified in our community. Hold on one second. And these are just a few of the comments, and the stories that we have experienced over the past few years are so incredibly powerful and speak to the work that we are doing and those that we are serving. So one of the things we do would, before we go to a community to provide vaccine education and information and vaccinations, is we work with that host partner. And we say, well, what would best serve your community that when we're going to be out there that we can provide? And so I want to put this into context, this one quote in here. This is in the midst of the pandemic. And this is what she told us from a mobile home park that primarily were Latinos and Hispanics living. She said that our residents and families, our children, are sharing toothbrushes. This is in the midst of a pandemic. So we quickly galvanized and made sure when we showed up with vaccinations, we also had toothbrushes. We had toothpaste on hand. And we just recently connected with this mobile home park manager again. She called us and said, we want 2 more events now. So we're going to be going back there again, and we're asking, what do you need? And she said, we're still handing out those toothbrushes. People are still grabbing those toothbrushes because they need them. So Dr. Pam, if you wouldn't mind going to strategies.
Yes, hello everybody. Thank you, Lisa. I'm Dr. Pam Herr, and I'm part of MCI as well too. One of the things that I think I want to just kind of continue on with Lisa's thoughts around this is that during the midst of COVID-19, it was a crisis for all of us, right? In general, and then especially in the communities of color. But we took a step back, and in the midst of crisis, we all made the decision that this was also going to be an opportunity for us to build sustainable changes, and an opportunity for us to cultivate sustainable, trusting relationships. And so we became very intentional in everything that we did. It wasn't just about getting shots in the arms for us. It was about creating an experience that would lead to more trusting relationships for future potential challenges, which we knew are inevitable, right, in the society that we live in and everything that is happening. And so as we looked at this, one of the strategies was really having this mindset of, this is about community building. This is about creating an experience. And most importantly, this is about social connections. And it's really interesting. This morning, Lisa and I had a conversation because Lisa was in a space where she had heard about the U.S. Surgeon General. And one of his key priorities that he's focusing on right now is in the areas of social connectedness and how that can impact so many things within our lives, so many things around well-being, and all the health pieces as well too. And that was something, even before he put it as his priority now, that was something we wanted to focus on, was really about social connectedness and how were we going to do this. Next slide, Lisa. So one of the things that we talked about was really, how do we create this experience of belonging? Because belonging sometimes is this, word that we're all using and we're trying to create and all of that. But for us, it's stepping back and really listening to our communities of color and those who are most marginalized and oppressed, and just listening to what they need. Not going in and say, you should do this, you should do that, you should do this, you should do that, but to really listen to them. Because for a lot of these communities, no one's truly ever listened to them. We only go in when there's a crisis mode. We only go in when we want them to do something or comply with something. And so we decided we were not going to take that approach. We were going to take the approach of meeting people at where they were at and to truly listen to what they wanted, what they needed. And so although we organized around COVID-19, one of the things that Lisa also alluded to was that we also met their needs. Whatever it was that they needed. There were some, hosts in spaces where families needed snow pants and boots for their kids, and we provided that. Others needed coats and jackets because we live in Wisconsin and it's cold. And in the middle of, everything that is going on, the last thing you need to worry about is trying to find a coat to stay warm. And so those are the things that we really focused on, in addition to education, and not only educating with the materials that were given to us, but looking at those materials and understanding the literacy level of the communities that we were going to. We couldn't use big words and then, expect them to understand what that meant. Many of them didn't understand that. We also went in and started looking at ways that we could deliver messaging to them in ways that they would understand it. Some of their community members looked at pictures. They could understand pictures and symbols and things like that, and that would make sense to them. Whatever it took for us to relay this message effectively and factually, that is what we really, really focused on. And through that piece, they began to feel like they belonged because we were co-creating safe spaces with them, not going in and telling them what they should do and what they shouldn't do, but to listen to them and then to meet them at where they were at. And to Lisa's point, we met a lot of people physically as well in the spaces they were very comfortable at or felt safe at. For example, the Hmong markets, the different mobile home parks. We went to our Black African American community in their barbershops, in their hair salons, in churches, in places where they felt safe and they were willing to have conversation. And our goal every time we went into these events was not to make people get shots or convince people to get shots. Our goal was to answer questions, provide factual information, and then allow them to make that decision, whether or not they wanted to get vaccinated along with their families. So that was really, really important to us. Next slide. So, we talk a lot about trust, right? And we talk a lot about the things that we wanted to do. And one of the things that we realized was that sometimes when we're in the midst of a crisis, we have a tendency to put our blinders on because this is how we've always done it. And so we're going to continue doing it this way because this is all we know. Well, we decided we're going to remove those blinders, and we're also going to empower and elevate those that have been doing this work for the last 20, 30, 40 years that have never been acknowledged. The ones that have done it as volunteers for the last 30 years. And so in that context, we went to the culturally based organizations and their leaders and their community advocates, and we told them, you have the trust already. We will help you cultivate that trust by providing resources for you, by breaking down barriers, by removing systemic pieces that are obstructing your ability to truly create that safe environment and to move your community forward. And so in that, belief that we really needed to do this because this was the right thing to do, we partnered our first initial partners, and these organizations continue to be very instrumental. They sit on the board. Some of them sit on the board of MCI. Others are members of MCI. Is, New Monk Professionals, Casa Hispana, Pointers, Partnership Community Health Center. They were instrumental. They worked with a lot of low-income families, and many of them are families of color, people of progression. All of that, those are all our key organizations that we always went to when we were looking at doing different things within our community to understand through their lenses what their communities are going through. And so trust was ours to lose. As I always tell my team, trust is ours to lose. And so when we think about trust and how we build trust and how hard it took us to build trust, that it keeps us grounded in what we need to do and the right things to do. Next slide, Lisa. From there, it's really talking about how do we organize, right? So bringing in these different groups and organizations, that was the key. But then in that context, how do we even get all these things up and running? The one thing that was really critical was understanding and listening, and truly listening, and not through our own lenses, but to start shifting our lenses to deeper understanding, to hear what people actually had to say, and to understand deeply that lens in which they were sharing their lived experiences with us and their needs. And then looking at those around us, right, as allies and advocates that could be there to help support us and these culturally based organizations. And then to bring people together to interact and to start co-creating safe spaces. That was really, really important. We couldn't just go, okay, we created something, everyone come, and we're going to do all of this. We realized that to get people to the table, there had to be pieces that we had to do to create that trust piece before they were willing to come to the table. And last but not least, we rallied people around actions. We were not about just talking about what we wanted to do or what we hoped to see or what we thought we could do, but we rallied around what are the actual actions we're going to take, who's going to do what, and when are they going to do it. And everybody was held accountable for their piece within our organization in the organizing piece of what we had to do. And through that, we have been able to really, really, cultivate trusting relationships that people look at and say, this is not an organization or a movement about talking and about feeling good because we talked about it and hopefully it happens, but this is a movement about actions. And that was very powerful to the culturally based organizations, very powerful to what we needed to get to be able to be successful and build sustainable changes. So some of our key partners, I already talked about: culturally based organization, trusted community members, nonprofits. United Way of the Fox Cities has been astronomical and phenomenal in their support of us. I also want to talk a little bit about disruptors. One of the things that we learned was that disruptors are, when we think of disruptors, we usually think of something negative, but for us, it was something that was really positive. As we worked with different organizations and we began to tell our story of where we were going and how we were doing this, and we wanted them to be part of that story, part of that solution, we realized that there were certain people that we could talk to that became the disruptors for us. They would actually help us remove barriers that have been in place for 30, 40 years without a thought, because they believed in the work that we did. And those are probably, Lisa, I think those are probably some of our most powerful allies and individuals that really helped us be able to remove barriers. One of the things that Lisa and I early on committed to was that there was no barrier too big for us to remove. So we either go over, under, or through it, but somehow we were going to do it. Because if that was a need within our communities of color, if that was a need for them to be successful, to protect their families, to thrive, those are the things that we are going to remove to make sure that it happens. And so we had to have a lot of partners. We can't do this alone, and we knew that. But in order to get to this space, we also needed our partners to understand that we were action-oriented, and that's why we were focused on removing barriers and all those different pieces. So the equity piece became really, really top of mind for us. Lisa?
Thank you, Dr. Pam. So when we talk about being action oriented to this day, so if it's COVID, if it's misinformation, if it's access to vaccinations, we are going to identify those barriers. So from a community level, more local community level early on, barriers in our community, and I'm sure many of you face those where, maybe it was asking for IDs, asking for health insurance. And we eventually got to that point with those trusted partners that we had to make sure that those things weren't happening. And so we had to have those discussions up front. So fast forward to today, we continue to identify barriers in place for those we are serving. Dr. Pam says we kick aside, we bust through those barriers. And we're going deep for community change overall. So yes, we have COVID at the forefront, has been at the forefront, but we're really looking through that cultural competency lens. How can we move the needle in our community when it comes to the cultural competency and all the barriers that exist in place? And then along those lines, we're looking at systems change. How can we make long-term change? And if you remember, as we said from the beginning, our work as organizers, it began with COVID, and it's going to continue on when we shift and look at other areas that need more systems change when it comes to education, when it comes to just overall that health equity piece, and then that trust building through engagement. That engagement piece, Dr. Pam and I talk about this all the time, and with our board and our communities as we work through, we might be doing the same thing perhaps as another organizing group or a private healthcare system, but our delivery of experience and back to what we were talking about, that social connection, that's going to be our piece of difference. So early on, from our perspective, listening to the communities we were serving and seeing what was taking place, and people will ask me, well, what are your numbers? How many are you vaccinating? We got to know that 25 people are going to show up. And we'd be like, you know what? If one person shows up, that is okay with us. And we are going to deliver them the best experience they've ever had. And we're going to work on that social connection and that place of belonging with them. What can we do to make that experience better? So if they need further resources, we're going to be a resource for them. If the next pandemic, let's hope that doesn't happen, comes around, we're going to be in a much better position. Whatever comes our way, we feel much stronger collectively together today than we did 3 years ago. So, and I talked a little bit about that building of partners and communities inside and out approach. The change begins with us. And Dr. Pam has heard me personally on my journey. I got very frustrated during the pandemic and was looking to others. And then I realized, oh my gosh, the change begins with me. And that was a wake-up call for me. And then working with Dr. Pam and all the communities that we're serving today, like, how can I be my best me to help serve others? And we're hoping that the more what we call planting seeds throughout our community, we're going to get to that tipping point in our community as well. So this is, you boil down all your work to one slide. It's like, oh my gosh, it's taken a lot of work to get there, but this is about a snapshot of the work that we've done. So if we look at 350 points of contact, that means we hold monthly meetings with our community members. That started at the beginning when we started pulling the coalition together. So we're constantly and continue to serve up the latest and greatest COVID information, as well as other areas from mental health services, culturally based organizations. What are some of the community events going on? What are we offering when it comes to telehealth and COVID? So literally 350 points of contact when we look at all of our relationship community building. 65 collaborating partners. I think that's on the low end. We have collaborated with unbelievable amounts of partners through this work. We could not do it alone. Thousands of life impacted. If you want to look at, we've probably vaccinated, I think it's right around the 2,000 mark. And then also, like, on a very basic level, I think literally have touched 10,000 people's lives personally. And that's through events that we've been at and vaccination clinics that we've done and people who visit our office. I was telling somebody yesterday, at any given point, because of our relationship building and conversations with the refugee community, at any given point, I have refugees coming into our office for more information and more relationship building and connection. And, you know, it comes down to that social connection again. So this just kind of quickly and easily summarizes our impact. And one other thing, you know, I think it's easy to get caught up in like, okay, what's next? What's next? What's next? And then there are those moments in time when you're doing this community organizing work and you just like take a step back. And Dr. Pam has heard me say this, that there was a member of the Hmong community, and we had a call, and she said, thank you for your work that the coalition is doing. You're literally impacting generations. And I just kind of sat back like, oh my gosh, like we look long term, but I hadn't thought that long term, the impact of this work as community organizers and how that partnership with so many organizations and people has led to this. So our work is not done. And I told somebody too the other day, I feel like we're just getting started, even though we've been at this 3 years. So I think we mentioned our health equity work, that social connection, mental health, the employment equity, the affordable, accessible housing. Like, this housing crisis in our area is really, really bad. And I will tell you firsthand, and anyone in our group, anyone doing this work will say we're really struggling. It is a crisis. And at any given point, we're receiving texts, receiving phone calls about people who are living in garages, living in hotels. Like, what can we do? What is that action piece? So we're tasked with that as well. And then, you know, when it comes to community organizing tips, these are just a few. Again, it's so hard to summarize, but again, when we looked at what was happening with the pandemic, how can we build this in a sustainable way? One thing I want to make sure too, we had on another slide, is our partnership with Partnership Community Health Center, our locally federally funded community health clinic, has been priceless. The synergy between our work and what we have been doing with them and all our culturally based organizations, we have literally built another safety net in our community. And so at any given time, we have these trusted partners in place. How can we help serve? What's going on? What do we need to do next? And there's a lot of in these tips about, you know, speaking up when you encounter barriers. And I'll tell you, this group, Multicultural Coalition, we have had some tough conversations like, oh my gosh, but we need to go there. In order to make change, we need to have the tough conversations. So the last bullet point on here is listen, plan, act, pivot if necessary. And that's the beautiful thing of what we are able to do. We can plan as much as we want, but we never know what's going to be thrown at us, and we can pivot like nobody's business. Dr. Pam?
I just want to say one last thing. We do this work and we do a lot of planning, but it is the spirit of the work that drives us and helps us be successful. That's why we're willing to pivot, because it's the spirit of it. Things don't go as planned, but this is what we want to accomplish. So remember that when things don't go as planned for you or in your organizing and things start to happen, is that spirit of that work, that piece that brings you all together, that will keep you going and driving you in the right direction. Thank you.
So with that, I don't know, I think we're a little bit on time. We have time for a few questions.
Absolutely. Thank you both so much for that presentation and for sharing your really impressive work. I love, hearing everything that you've done and the collaborative partners and everything. It's just everything that the National Civic League cares about and thinks is important in regards to, yes, COVID, but really any community crisis. And just thank you for stepping up and helping your community when they needed it. And Erin, thank you so much for kind of giving us that higher view of, the kind of campaign and everything that you all are doing at the national level. Important information. Thanks for sharing that. So at this time, we are going to take a couple of questions as we have time available. So I would ask that if you have a question, please either type it into the chat or use the raise hand feature on the side of your screen. All right. I have a question coming through here. So my community has, quote unquote, moved on from COVID. Do you have suggestions and messaging for how to stress the continued need for vaccines?
So I will start with that question. So one of the things, we are experiencing the same thing. So first thing for you to know is that you're not alone. We are all experiencing that. One of the things that we have found that has been very instrumental is, we used to do events and create those events. Now we are embedding ourselves in the messaging and the work we do within existing events around different, communities and different areas. So for example, the New Monk Professionals has a volleyball camp, works with tons of families and with children and with students and all of that. We would go to one of their last event, which is their tournament, and we did a pop-up vaccination clinic there, along with other community resources and all those different things. So when we organize, it's not just clinics or just pop-up vaccinations, we also bring along other community resources. And we found that has been very, very helpful to not create so many things for people to try to understand and go to and remember, but to be embedded into those spaces where they are most comfortable, what's normal for them to be a part of, and to continue messaging through those spaces and those venues. And I think that may be helpful for you, and it has been very helpful for us.
Thank you.
One other thing I would just add is that I've been putting this down in a lot of our grant reporting is our state offers the telehealth. I don't know how many other states offer that, where you can be evaluated via telephone or Zoom call, and then the ability to be prescribed the antivirals. And that information serves as a great opener to vaccination. So instead of heading straight into are you vaccinated or not? Like if anybody knows sales, you don't ever ask a yes or no question. But having that opportunity to talk about, hey, if you get COVID, just so you know, this is available to you. And then the conversation can gradually get to they will probably divulge like, yeah, I haven't been vaccinated. Oh, why not? Tell me more about that. So I like to approach it. This sounds weird, but sideways. Don't come right at it, because then people get defensive. So that telehealth program for me and our group, every time I keep asking, like, how long is that program going to last? Because we need it to last a while yet. So it's a great conversation opener about that vaccine fatigue.
Wonderful. Thank you so much. All right, I have a couple of questions here about trust. I'm going to try to kind of package them into one for us. So any tips on how to rebuild trust with the community? This is coming from a community health educator. And then how to initiate community members to conversation with community members to help build that trust. So they have a story, an example where someone was highly resistant to getting vaccinated. If you have a story about that and how you handled it, would be helpful.
So I'll start with the one about rebuilding or building community trust, right? And how do we do that? I think it's how we redefine what cultural competency is and how we understand it much deeper. A lot of times we think of cultural competency as bringing other people in. It's they and them coming to educate us so that we know more about their culture and all of that. But the question I always ask people is, through whose lenses do we process that information? And do we understand what's deeply embedded in those lenses from a, privilege, implicit, unconscious biases and microaggression piece, right? Because those are the things that we use to filter everything. because we have those in everybody, I don't care what gender, what race, what ethnicity, what identity you are, we all have privileges, implicit and conscious biases, and we commit microaggressions all the time. And we don't do it from a space of intention to harm people, but that's being human and not really understanding all these things that we don't know that exist, right? And so as we were doing this work, it was really important for us, as we extend our trust that we're building with these communities to other organizations, that they needed to understand what cultural competency is. And cultural competency starts with each one of us, the lenses that we use to filter everything. And by going through that cultural competency journey, we will begin to be able to tell our story of who we are, not someone else's story, but our story of that journey. And you'll be amazed at what people can do and feel when they are hearing your story, your struggle, your vulnerability of trying to understand your lenses and how you use it to make decisions and all of that, that sharing those stories with them is a great starting point for building trust and co-creating safe spaces. And so that's what I would challenge everyone with, is that to build a trusting relationship, you also need to deeply understand what's in your lenses. I have a model that says you can only understand others as deeply as you understand yourself. And so that really is that lens piece. And that's one of the things that we really push for within Multicultural Coalition. And the organization is really working in the context with a lot of our partner organizations on their cultural competency lenses that starts with each individual that does the work within their organization. So I hope that answers that. And then Lisa, you can talk about the highly resistant if you want to.
Yeah, I think the story that came to mind was we were serving the Hispanic population, and a young teenager came in to our pop-up at the mobile home, and he wanted a vaccination. His mother did not want to let him. So he was talking to us, and we explained to him that you need to get your mother's permission in order to do this. He took off across that field and ran and got her, brought her back, and she was resistant. There were some family dynamics that she, I don't want to say wasn't allowed, but highly discouraged from getting vaccinated. And therefore her son was also not able to get vaccinated. And, it was just interesting because, again, you can't go at this like, here's what I think and here's what I say. We had a physician on site that had such a beautiful way of approaching the situation. And we had an interpreter on site. And he just looked at her and he said, "And what are your concerns?" And so he did not start, the diatribe of talking about why you need this, but listened. And this listening piece is so key. And listening without thinking about what you're going to say, you have to stop and listen. So he was able to answer her concerns. And I, off the top of my head, I cannot remember what those concerns were, but there was a litany of them. In the meantime, she gave permission for the son to get vaccinated. And then the son was in the observation area after he got vaccinated. So she acquiesced. And actually, I do remember this. One of the points was the conversation went down the path of, as a mother, this is an opportunity for you to help keep your child safe. So he got vaccinated. I walked back out, and sure enough, the mother was sitting there getting vaccinated herself. And I walked back into the observation, and the kid, he was about 15 years old. And he looked up at me and I said, "You did really well today. Like, do you know what's happening right now?" And he looked at me and he's like, "What?" And I said, "Your mom is out there right now getting vaccinated." And he was so full of pride. And think about the influence he had on that family and their safety and their health. So it's kind of a long story, but there were a lot of dynamics going on and a lot of barriers in place. And she had a lot of questions and concerns about vaccination, not only for her child, but for herself as well.
And I just wanted to say, Lisa, really quick, that what our experience has been, and it might be different where you are, but what our experience has been in what we have encountered is that a lot of times people are resistant because they have concerns that have not been adequately addressed. And whether that's cultural barriers or language barriers, we were very intentional about bringing culturally informed physicians and doctors into our spaces. When we went to these events, we brought nurses that spoke, that were able to communicate. We brought in pharmacists that were that saw through a cultural lens, understood why some of these people were asking those questions. And so because we answered questions, many of them got vaccinated. So that's what we found, was that they're resistant is because it's not because they don't want to, it's because there's things that they're afraid of, that no one's answering it properly. And so for them, until that's answered properly, they don't want to do anything because they don't know what's going to happen. So
I want to be respectful of everyone's time and our speakers. It seems like there's some really great conversation going on. At the permission of our speakers, in our follow-up email, I will share contact information. So if you all want to continue the conversation, you can do so, but I do want to be respectful of everyone's time. I feel like we put in a wealth of information, and some great stories came out of this today. So I just want to thank Erin and Dr. Pam and Lisa, I'm sorry, for their time and all of the experience and expertise that they brought to this. And then thank you all for spending your afternoon with us. We really appreciate it. And then for those of you on the call, this is a monthly webinar series. So we will have another one. Actually, we have 2 this month. So we'll have a second webinar in May, and then we will continue with our monthly series in June. So be on the lookout for future webinars, the recording, slides, and additional contact information from our speakers. Thank you all so much. Enjoy the rest of your day.
Thank you.
Thank you all.